Bladder carcinoma. Urogenital system of the human body consists of two kidneys, two ureters, and a single urinary bladder, then which opens into the urethra to convey the urine performed by the filtration of the kidney outside the body. There is pair of kidneys and pair of ureter. There is a muscular organ, muscular sac, which is called as urinary bladder. The urine which is filtrated by the kidney is stored for a short while in the urinary bladder. The urinary bladder consists of inner transitional cell or urothelial lining epithelial cells. There is also a limited quantity of squamous cells and adenomatous cells, which are mucus-producing cells. This is the inner layer of the bladder. Next to that is a basement membrane. Then next to basement membrane, there is a lamina propria, which consists of connective tissue, which is containing the blood vessels, supplying the vessel and nutrition, blood and nutrition to the walls of the bladder. And outside the lamina propria, there is a muscular layer, which is capable of contraction and relaxation according to the amount of urine collected in the urinary bladder. And outside this muscular layer, there is a fatty layer. So this is the anatomy of the walls of the urinary bladder. The carcinoma, which arises from the inner layer of the epithelium, which is mostly the transitional cells, that is called as urothelial carcinoma. It is more prevalent in men as compared to the females and usually appear after the age of 40 years. Due to various causes and the constant and persistent and prolonged irritation and inflammation of the inner epithelial, that is uroepithelial cells, the DNA of the normal epithelium is distorted or deranged or destroyed, and they are converted into abnormal DNA, that is called as cancerous DNA. The cancerous DNA has no command over the replication, has no command over the replication of the epithelium and cannot limitize the life cycle of the epithelial cells. So there is vague, harmful, and progressive and limitless division of the proliferation of the urothelial cells, that is the cancerous cells. So that this carcinoma is produced by the mutation of the normal DNA of the urothelial cell or the transitional cell into the DNA of the cancerous state. So this division, which is a absolutely useless, harmful one, that form of balls or the tumors. So this tumor produces pressure over the blood supply of the normal tissue of the surrounding in the bladder. So the blood supply is decreased and ultimately is completely occluded or obstructed. So due to this ischemia, lack of supply of blood supply, oxygen and nutrition to the surrounding normal tissue of the bladder, those cells die away and fibrosed. So this is the function of the cancerous cells, that they occlude or disrupt the blood supply of the neighboring normal tissues. Due to abundant oxygen and nutrition supply to the cancerous cells, so they go on replications. Then they are libertized to the inner surface of the bladder, but they also penetrate into the different layers of the bladder. The main etiology of the bladder carcinoma is tobacco smoking. That is, smoke of the tobacco consists of thousands of the carcinogenic factors that produces, which is filtered by the kidney and passes along with the urine in the urinary bladder. After several years or decades, these chemicals produce irritation, inflammation, due to which there is mutation of the DNA of the normal cells into the cancerous DNA. So that assumes the form of bladder carcinoma. So this is the main cause. That is the carcinochemicals in the smoke of the tobacco. Next is age factor, above 40. It is also has genetic predisposition. In addition to these, minor factors may contribute, that is the exposure of the radiotherapy and the chemotherapy to the other organs, excluding the bladder in the pelvic area. For the treatment of those organs, the normal bladder tissue, they also suffer by this anti-tuberculous treatment. So these are the etiological factors of the urinary bladder.